Hello and welcome to Controlling the Spread of Infection, Part 1. Have you ever caught a cold or flu from someone? You can lessen your chances of getting sick and avoiding passing on an illness to someone else by learning about what causes infections and how infections can be spread. So what causes an infection? Microbes, or microorganisms, which are tiny living things that are too small to see but are all around us. Microbes can only be seen using a microscope. Examples of microbes include bacteria, viruses, fungi, yeasts, and molds. Most microbes grow rapidly wherever they have warm temperatures, moisture, darkness, and food. These characteristics make the human body an ideal place for microbial growth. Now, some microbes are harmful to humans and some are not. Harmful microbes that cause disease are called pathogens, and a disease caused by a pathogen is called an infection. The body has many natural defenses against infection. Healthy, intact skin and mucous membranes help to prevent microbes from entering the body. Mucous membranes are sticky, moist membranes that line the respiratory, genitourinary, and digestive tracts. Reflexes, such as coughing and sneezing, help to expel microbes from the body. And finally, white blood cells carried in the blood are able to destroy pathogens that enter the body. These natural defense mechanisms help to keep us healthy. And even though our bodies have ways of protecting us from infection, and there are medications available to treat some infections, prevention is still the optimal goal. Some infections can be fatal, especially in people who are not otherwise healthy, and some infections cannot be treated with medications. So let's talk about the chain of infection. Many infections can be passed from one person to another. However, for this to occur, 6 requirements must be met. And these 6 requirements are called the chain of infection. Eliminating just one link in the chain can prevent an infection from spreading. So let's take a closer look at the 6 links in the chain of infection. For an infection to occur, a microbe capable of causing a disease must be present. Reservoir is a French word that means storehouse. So here we are using it to mean a place where microbes can grow and multiply. Possible reservoirs for microbes include the bodies of people and animals, bodies of water, and food. The portal of exit comes from a Latin word meaning gate. So an infection to occur, the microbe must have a way of leaving the reservoir or a portal of exit. The portal of exit varies depending on the pathogen and the reservoir. When the reservoir is a human or an animal body, the portal of exit may be the respiratory tract, the digestive tract, the genitourinary tract, or breaks in the skin. The way a pathogen gets from one person to another is called the pathogen's method of transportation. The method of transportation may be direct or indirect. So in direct transmission, the pathogen is passed from one person to another through close physical contact, such as touching, kissing, having sex, or breathing infected air. Indirect transmission means that pathogens are spread by way of a contaminated surface or object. A contaminated surface or object has been soiled with pathogens, and usually this situation occurs with an infected person touches something and then someone else touches the same object. So for example, if you have a cold and blow your nose into a tissue and someone else picks up that tissue to throw it away without wearing gloves, that person can get your cold by indirect contact. The germs will spread from your nose secretions to the tissue and then to the other person's hand. So just as a pathogen must have a way of leaving the reservoir, it must also have a way of gaining entry into a new reservoir. This is called the portal of entry. So in a case of person-to-person contact or animal-to-person transmission, potential portals of entry include the respiratory tract, the digestive tract, the genitourinary tract, the eye, and breaks in the skin. Finally, the pathogen must enter a susceptible host, or a person who is capable of becoming infected with that particular pathogen. Some factors increase a person's susceptibility to infection. including the very young or the very old age, people who are in generally poor health, and the presence of medical devices that are placed in the body. For example, a urinary catheter. Many of the people you will care for will have these risk factors that increase their susceptibility to infection. Let's talk about healthcare associated infections. It's basically when an infection a person gets, they get it while receiving care either in a healthcare facility or while being cared for by healthcare givers in their home. So let's take a minute to watch this video of how you can protect yourself as well as your patient.
It looks like the doctor.
What's that on his tie?
Oh my gosh, it's MRSA.
Oh no, he just transferred the MRSA to the counter. All over the counter. Did he just touch his tie?
I think he did.
He did.
Oh, he touched his tie, and then he put his hand on her arm.
Look at his tie is on the IV site and her arm. Oh no, and now it's on the side rail.
Yes.
He didn't wash his hands.
I don't think he did.
Oh, now it's on the door.
He's contaminated the door.
Other patients, here we come. Okay, who's next? This looks like a tech, maybe. What is that, C. diff?
Oh my gosh, there's C. diff on the blood pressure cuff.
Oh no, it's on the patient's arm.
And the stethoscope.
And she didn't wash her hands either.
No, she didn't.
Oh, she just transferred it to the bedside commode.
And instead of wiping down the blood pressure cuff, she just put it in its container.
That video really drives it home about how we need to pay close attention to where we have our hands and when we wash them. Make sure we protect ourselves and our patients. So let's move on and talk about how we recognize infections. An infection occurs when pathogens grow inside the body, so almost any part of the body can become infected. You can recognize a possible infection in a person's body by certain signs and symptoms. The signs and symptoms of infection vary according to the pathogen and place of the body where the infection is occurring. If you notice that someone in your care has one or more of the signs and symptoms listed here, report your observations to the nurse. By recognizing infections early, you help ensure that that person receives prompt treatment, which in turn helps to prevent the spread of infection to other people. But remember that not all people with infections will show common signs and symptoms. So that's why it's important to practice infection control with every person in your care, even when you do not observe any signs and symptoms of infection. So in older adults, fever may not be present even if an infection is present. And that's because many older adults have other chronic conditions. They're taking medications, or they have changes in their immune system that can interfere with the body's ability to produce fever. So be alert for some of these other possible signs and symptoms in older adults. And stay tuned for part 2 of how you can specifically control the spread of microbes. Thanks.